You are listening to Pharmacy, IT, and Me, your informatics pharmacist podcast. Hey everyone, this is Tony Dow, and today is Friday, August 2nd, and welcome to another episode of Last Week in Health IT. As with every episode, we start this one saying that the intended audience for this episode is everyone. So let's just get right into it. The first news item is Cerner collaborates with Amazon Web Services. So the first news item this week is related to Cerner and Amazon Web Services. Cerner is one of the largest vendors for electronic health records, and they announced an agreement with Amazon Web Services to be their preferred cloud vendor, allowing lots of potential new skills and functionalities that Cerner can leverage from Amazon. This will allow a lot more work to be focused on interoperability and getting information and data portable across disparate settings, allowing an increase in better outcomes through the continuum of care. With Amazon Web Services experience in technical aspects and, Cerner's long-standing experience in the healthcare innovation sector, this partnership seems like it will hopefully increase both companies' innovation timelines and potential to make a larger impact in healthcare. Alright, so the next news item is most of healthcare providers are seen to be lagging in readiness of digital health. So according to a recent HIMSS media report, it's looking like most providers are really lagging behind digital health. What this ends up meaning is that patients aren't going to be sticking around these providers, and they're going to be moving on to different healthcare systems or providers that are more adept with handling digital health. Organizations that don't invest in the tools and training necessary to keep themselves updated with the advancement of digital health tools are going to lose not only their patients, but they're going to be losing their employees and their healthcare staff who are looking to stay competitive and learn new skill sets. According to the HIMSS survey, only 11% of the 220 surveyed were actually early adopters, and 25% had some digital health plan readiness. So what that means is 64% were pretty much not ready. The biggest barriers noted were legacy systems compatibility issues, resistance to change, lack of skilled personnel, and privacy concerns. So I'm thinking there's going to be a lot of reassurances necessary to get these health systems to be in a better state of readiness. So the next news item is big tech companies remind everybody about their partnership and commitment to interoperability. So last year's, the major players in the tech industry, including Amazon, Google, IBM, Microsoft, Oracle, and Salesforce, they made an announcement that they are going to be committed to working together and advancing the healthcare integration and interoperability. So this year, they are joining once again to basically remind everybody that they're still committed and to show what progress they've been able to make. They made this announcement at the CMS Blue Button 2.0 Developer Conference on Tuesday, and what they've done is that they've sponsored many community events and conferences to spark innovation for cloud technology and interoperability standards within the FHIR ecosystem. In addition, with the new proposed interoperability rules that are going to be coming from the ONC, that's going to be going into effect somewhat soon, the companies have restated that they are going to be committed to offer support to follow and help develop technologies that would fit within the realm of meeting the requirements in the new rules. So the next news item is Kaiser Permanente creates a new position, Chief Digital Officer. So we end this episode of the podcast with a little news about Kaiser's new innovative position created for the purpose of innovation and creating a digital strategy for the entire Kaiser enterprise. This position is called the Chief Digital Officer, and they have named Prat Vamana in this role. His experience comes from the corporate world, where he's actually served as the Chief Product and Experience Officer at Home Depot, and he's had some leadership roles at Staples and also leadership roles at Informed Clinical Sciences Corporation. So hopefully his vast experience in the consumer world allows him to contribute unique ideas and strategies into the healthcare space within Kaiser's massive healthcare system. So before we go, if you would like to hear more news on healthcare IT, you can check out great curated articles on healthcareitnews.com. It's actually where I go for daily healthcare IT news to keep myself updated on what's going on in that world. Alright, if you guys like this episode, you can subscribe and rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme, or Instagram at PharmacyInformatics, or by emailing me at tony@pharmacyitme.com. And I also wanted to plug a great networking opportunity called Pharmacist Connect. If you are familiar with Microsoft Teams or Slack Workspace, think of Pharmacist Connect as a large vetted one through Slack Workspaces. I've met some great colleagues on it, and there's even an informatics space within it as well. You can find out more by visiting pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT Me. And remember, technology is the tool, patient care is the goal.